Hello Internet, welcome to this rundown review for pharmacy technicians. Today we will be covering pharmacology, specifically drug interactions. So to start off, what is a drug interaction? This is just an interaction between a drug, usually a prescription drug since we're pharmacy technicians, and another substance, usually another drug. There's 6 types of drug interactions. This includes drug-disease interactions, drug-drug interactions, drug OTC or over-the-counter interactions, drug dietary supplement interactions, drug laboratory interactions, and drug nutrient interactions. So tackling the first one, we have our drug-disease interactions. So this is where a drug can actually worsen a disease. So many times we have this interaction occurring because one drug is used for one disease and it worsens another disease in that client. For example, NSAIDs, so non-steroidal anti-inflammatory drugs, they can cause fluid retention. This fluid retention can cause hypertension, which is also high blood pressure. If the patient already has high blood pressure, we have complications there. Another example, some decongestants can also cause vasoconstriction or blood vessel constriction, and this also raises blood pressure. Next, we have our drug-drug interactions. This is probably one of the more common ones and the one you'll probably discuss about more, because many times one drug interacts with another drug. For example, nitroglycerin and sildenafil, they cause an increased risk for hypotension or low blood pressure, and then there's complications associated with that low blood pressure, so we need to be checking that medical history for any interacting drugs. Next, we have drug OTC interactions or drug over-the-counter interactions. This is often classified as your drug-drug interactions as well. It really depends on what classification, who you're talking to, where they get the drug from, etc. However, for the PTCB, you do want to know that there's drug-drug and drug over-the-counter interactions, and there's a difference. So many of your over-the-counter drugs will react with some of the prescription drugs, and many times this is the most common reaction you'll see in clients because clients buy the over-the-counter drugs and then they don't talk to their doctor, their physician, their pharmacist, or any other healthcare professional to see if there is a reaction. So there might be a reaction because there's just no knowledge there. For example, a patient on warfarin that then takes over-the-counter aspirin has both an increased risk for bleeding as well as non-coagulation. So these are both anticoagulants and they inhibit the ability to clot or slow any bleeding that might occur. So you can see why that can be dangerous. Here we have our drug dietary supplement interactions. So you want to make sure you know the difference between over-the-counter drug and a dietary supplement. We go over that in another video, so you can hop on over and look at that if needs be. But just remember that there are dietary supplements that will interact with multiple drugs. For example, St. John's wort is one with a greater potential to actually interact with many different drugs. So then we want to ask specifically about that one when we're talking about their medication history. One interaction is St. John's wort reacts with SSRIs, or selective serotonin reuptake inhibitors, and can actually cause a syndrome called serotonin syndrome, which is increased levels of serotonin in the blood. Next, we have our drug laboratory interactions. This one's a little bit different because this is where the drugs actually affect your laboratory results and can cause false negatives or false positives in testing. For example, if you have antibiotics or you're taking antibiotics, if they're not taken on the right time or if they're giving right before drawing labs, such as in IV antibiotics, this can actually affect the lab values that indicate whether the infection is improving or worsening. And our last interaction we have to talk about is our drug-nutrient interaction. This one is specifically talking about nutrients, including your vitamins and mineral supplements, as well as foods that can interact with drugs. This can cause the drug to have an exaggerated or diminished effect, and grapefruit is one in particular you want to be aware of. This interacts with many drugs and should be one to ask about when talking about medication history. For example, grapefruit juice can modify the way a person's body metabolizes a prescription drug such as atorvastatin and increases the risk for adverse reactions of that drug, such as liver damage with atorvastatin. And that is it for this rundown review for pharmacy technicians, talking about different drug interactions and the drug interaction type. I hope this helps you out. If you are studying for a test, good luck on that test, and I hope this helps you out for that test. If this did help you out, please help me out by dropping a like and subscribe so I can continue to make these videos and for future videos as well. Thank you for watching and good luck.